Hi friends, welcome to Interactive Medicine. In this section, we are going to discuss the third section of our chapter, and here is the classification. So, what we can say, frankly, there is no universally accepted classification system, but we can use the Ongren's classification. What happened here? A line drawn between medial canthus and angle of mandible, and this line is known as Ongren's line. So it crosses the maxillary sinus, the suprastructure and the infrastructure. The superior portion which crosses the Ongren's line is known as suprastructure. If tumor here, it can say poor prognosis. If the tumor is resides in the infrastructure, we can say it is in good prognosis. Ongren's classification is an imaginary plane extended between medial canthus of the eye and angle of mandible. Growths situated above this plane have a poor prognosis than those below it, that is the supra and infrastructure. And second one is AJCC. It's a tumor TNM classification and staging system of cancer of maxillary sinus. So here I am drawing our maxillary sinus, and the tumor is limited to maxillary sinus mucosa with no erosion or destruction of the bone. We can say it is in T1 stage. And T2 stage, what happened? Tumor causing bone erosion or destruction, including extension into hard palate and or middle nasal meatus, except extension to posterior wall of maxillary sinus. Okay, maxillary sinus and pterygoid plates. And what happened in T3? The tumor invades any of the following: bone of posterior wall of maxillary sinus, subcutaneous tissue, floor or medial wall of orbit, pterygoid fossa, and ethmoid bones. You can see here the tumor is invading into orbit region and posterior region. You can see in lateral region. Okay, for more clear understanding, you can see our pterygoid process here, and the tumor from the maxillary sinus invades into the posterior walls of pterygoid. You can see here. This is in T3 stage classification. And in T4, we have two classifications, T4A and B. In A, tumor invades anterior orbital contents, skin of cheek, pterygoid plates, infratemporal fossa, cribriform plate, sphenoid or frontal sinus. So in 4B, what we can see, it extends into the orbital apex, dura mater of brain, middle cranial fossa, nasopharynx or clavus, cranial nerves other than maxillary division of trigeminal nerve, that is V2. And where is the clavus is located? It is located in the anterior portion of the occipital bone, right? Here. This is in T4B stage. And regional lymph nodes N, which means we can basically divide into NX, N1, N2, N3. In N2 we have three classification, A, B, C. NX, which means that cannot be accessed, okay, or cannot be accessed. In N1, what we can see, the metastasis is not no metastasis into the near lymph node. In N2 we can see the tumor growth size 3 to 6 centimeter and metastasis ipsilateral as single, and in B, ipsilateral region and more than one lymph node is affected and it is less than or equal to 6 centimeter. In C, bilateral or contralateral and it is in less than 6 centimeter. And in N3, what we can happen, metastasis is greater than 6 centimeter. And distant metastasis cannot be accessed, no M0, no distant metastasis, and M1 is distant metastasis. And the classification of cancer of nasal cavity and ethmoidal sinuses. Tumor restricted to any one of subtitle with or without bone invasion. In T2, tumor invading two subsites in a single region or extending to involve an adjacent region within the nasoethmoidal complex with or without bone invasion. T3, tumor extend to invade the medial wall or floor of the orbit, maxillary sinus, palate or cribriform plate. T4A, tumor invades any of the following: anterior cribriform, anterior orbital contents, skin of nose or cheek, minimal extension to anterior cranial fossa, pterygoid plate. Sphenoid or frontal sinus. T4B, tumor invades any of the following: orbital apex, dura brain, dura mater, brain, middle cranial nerves other than V2, nasopharynx or clevus. I already said this concept, and this is the AJCC classification. So Lederman's classification. What here? So it has two vertical lines and two horizontal lines. Vertical lines is drawn in the medial wall of maxillary sinus along the medial wall of orbit. The horizontal lines, we have supra and infra. Supra is the border of superior border of maxillary sinus, and infra is the inferior border of maxillary sinus. We have three structures: supra, meso and infrastructure. The student may not hear that suprastructure and infrastructure of the Lederman's classification is not the same as in Oncrin's classification. And the Lederman classification, it uses two horizontal lines of Sebelius, that is the name of these lines, one passing through the floors of orbits and the other through floors of antera, thus dividing the area into suprastructure, mesostructure, infrastructure. Suprastructure, we have ethmoid, sphenoid and frontal sinus and the olfactory area of nose. Mesostructure, we have maxillary sinus and the respiratory part of nose. Infrastructure, it is containing alveolar process. This classification further uses vertical lines extending down the medial walls of orbit to separate ethmoidal sinus and the nasal fossa from the maxillary sinuses. So in this picture, we can draw the lines of Sibelius. It has the two horizontal, the superior and inferior horizontal, and two vertical lines. In supra region, what we can see, orbit and ethmoidal cells, and concha bullosa. In mesostructure, we have the maxillary sinus and inferior turbinate. In infrastructure, we have the alveolar process. The treatment and prognosis. So first we can talk about the treatment. We have the treatment which includes the surgery, radiation and chemo. In early cases with stage 1 and 2 squamous cell carcinomas are treated with surgery or radiation with equal results. And T3, T4 lesions are treated by combined modalities of radiation and surgery. Radiation in such cases may be given pre-operatively or post-operatively. Pre-operatively, dose radiation is 5500 centigrade, and the post-operative it is in 5000 to 500 centigrade. And the adverse effect of the radiation is optic nerve injury and lens injury. And we have new methods and like now three-dimensional conformation radiotherapy. It reduces the adverse effect. In chemotherapy, we have the 5-year greater more than 60% survival rate in 5 years, and 5-fluorouracil and cisplatin we use, and also 5-fluorouracil with radiation is we use, and 5-fluorouracil cisplatin we use in intraarterial infusion. And has also been good results in preference to deformities created by extensive surgery associated with advanced malignancy. And the prognosis include the 5-year survival is about 40 to 50%. That is the point. So in prognosis, survival diminishes with the stage of tumor. Overall, 5-year survival is about 40 to 50%. However, advances are being made in the multimodal therapy with improved techniques of radiation delivery with the hope to improve results and protect injury to lens and optic nerve. Okay friends, I think this video is helpful for you. If you have any doubts, you can ask in comments.